Welcome to the Caregiving Podcast. I'm Inga.
And I'm Julie.
And long story short, we have Caregiving. We are two momtrepreneurs who have built an in-home care business from the ground up, guided every step of the way by God's care and fueled by agape love. Almost 14 years later, we felt called to create this podcast as a resource for families with caregiving needs. Whether you care for a family member or are looking for advice on professional caregiving, we want this to be a platform to support you.
Each week, we will come to you with encouraging stories of families who have found the right balance for their loved ones, tips for how to care for them and you, and much more. We hope you continue to join us each week as we share in this exciting new journey together.
Hello, Sunshines, and hello, Julie.
Well, good morning, Inga.
You're on a roll this morning.
Well, let me tell you, this look, it comes naturally. It's kind of half Julie from the farm and Julie trying to pull it together to do a podcast.
Is
and
Julie,
it's not going great.
Is Julie from the farm like Jenny from the block?
Oh,
yeah.
I love that. Yes.
I don't know. Just checking.
Yes. I had to actually take load up a calf today, take him to the processor and do all of that. And I knew that I had to look halfway presentable for work today. And
good. Well, you look great.
We will take it.
And I'm glad that you got your farm stuff taken care of.
Yeah. It's just one of those days where all of the things that I do bleed into each other and you just have to go with it.
Yes. Heck
Yes.
yeah. Cool.
Yes.
Well, hips and knees, Julie.
Yes.
How are they? How are your hips and your knees?
Well, actually, I've been thinking a lot about them because every once in a while I'll get this achy thing and I'm just like, what was that? And then I won't have it.
Right.
And then my hip, every once in a while, I'll get a hitch in my get along.
Yep.
And then it goes away. But one of my very good friends from high school, my age, just had a complete knee replacement.
Oh, wow.
And so I have been thinking about her a lot, just going, what? Why? And darn it, ouch.
Right.
You know? And I don't want to have to ever do anything like that. But yeah, every once in a while something creeps up on you and you're like, well, that doesn't feel pleasant.
Yeah, I'm not enjoying that at all.
But I'm going to ignore it because I won't do anything about it.
True story. But we're going to talk about it today.
Yes, we are.
So we're going to tell you guys all of the things about hips and knees and pains and surgeries and when to do what. And then you can probably be a lot like us and not do anything about it anyway. But anyway, well, good. I'm glad it's only just an occasional glitch.
Occasional, yeah. And what about you? You're still young and spry, though.
You know, knees are good. I mean, I'm good with my knees. Every now and again, my hips get really, I think it's just to do with the low back stuff that I have occasionally. And so they'll get, but nothing like chronic or anything like that. And usually nothing that a good stretching won't help or chiropractor.
Yeah. Did you ever get that thingy where you like hang like a bat upside down?
No, I like the table where you like that inversion table or yes, I have not. No,
I've heard that cures what ails you.
Yeah. Probably cures a lot of other things. Yeah.
It also gets,
all the things that
it also
you.
gets blood to your brain. So that probably helps a lot of things.
Probably.
I need it actually.
You got to trust whoever's helping you with that. Well, they probably make them really good now where you.
Oh, yeah. No.
Can you imagine getting stuck upside down?
I could not trust Mike. He would leave me that way. Yeah.
He'd be like, well,
never mind.
Good luck to you.
Bad idea.
See you later.
Thought about it for a second. I got over it.
They probably have safety measures in place on these things, but probably not when it was originally a thing.
Okay. I'm stuck.
Oh, that's too bad. Yeah. Really shouldn't have back-talked me today, should you?
Good grief.
Yeah. Anyway, well, let's see. Our verse of the week, Julie. Today you brought to us, it is Psalms 30, chapter 30, verses 10 and 11. And this says, "Hear, Lord, and be merciful to me. Lord, be my help. You turned my wailing into dancing. You removed my sackcloth and clothed me with joy."
Yes. Just thinking about all those aches and pains, but yet we can still dance.
Yes.
Yeah, because he gives us that ability. Yep.
Yay for God. Yay, Jesus.
Yes.
All right. What did you bring for a good news story?
What did I? Oh, yeah. Oh, my goodness. So went to scrolling through Instagram the other day, and there was this gal that was getting her head shaved, and you could tell on her face that it was very, very emotional. There was no words, and it was just a song. And for some reason, I watched, I quit scrolling, and they were shaving her head. And then the young man, and he couldn't have been more than 30, that was shaving her head, was talking to her, and then found out that the reason she was getting her head shaved was because of chemo. Oh. So as she's getting sadder and sadder, as they're getting more and more hair off, he turned it and he buzzed himself. Oh. And then the guy standing next to him came over and put his head. So he gave him a buzz. And then the next kid, and they were all maybe mid-30s, if that. Oh. And so 3 of the help went. And then on top of it, the third guy that had gotten his head done, you could see that he was wiping tears away. Oh. And the woman in the chair just was sitting there with just this look like, I can't even believe this. And all it was for was showing love and support for a woman they had never met before. Yeah. I was like, there is good in this world. Yeah. Yeah. It's really a tearjerker. I loved it. I put it on my Facebook. I'm like
trying not to cry right now. So
it was pretty.
I'm gonna have to go watch the video.
And there was no words. Yeah. You could just see through the action what was going on.
Yeah. Amazing.
Yeah.
Oh, that's a good one. Yeah. I love it. I'm going to go watch it.
Yeah.
Well, mine, okay, I'm going to read you the story. A new animal therapy business using cuddly, woolly neighbors to help struggling kids and adults with their mental health. And this is a new thing, and the results have been unbelievable. So, UTalk, EWE, was launched by Emma Redman and Pippa Ashton last year after Emma was given the opportunity to buy a unique breed of sheep called the Valais Blacknose. Known for a dog-like temperament that makes them perfect for providing emotional support. The pair, they now have a flock of 7 sheep and 2 goats to help those that are finding life to be challenging. Studies have shown that animal therapy can have both psychological and physiological benefits. Emma's life has included accomplishments, joy, and memories, but was also filled with or misdiagnosed mental alterations, including OCD, anxiety, eating disorders, and ADHD. These life experiences have proven to be a big drive for creating something new and innovative as a way of supporting others. One of the things that we've always known is how useful animals are as a tool to help those struggling with diversities and mental health issues, said Emma. Sheep aren't used as therapy animals. People usually think more of like horses and dogs for those types of things. But from there, Emma and Pippa realized that there was a gap in the market for a unique animal therapy venture and decided to give it a go. We offer a safe space. If they want to talk to us, they can. But maybe they just want to play and giggle and laugh and run around with the sheep, said Emma. We want to be there to help anyone that needs us. We've got so much belief that what we can do is making a difference. Cute. So their flock includes the original duo of Autumn and Maggie, and those are Valais Blacknoses, as well as lambs Nellie and Ziggy. And also on the farm, they have 2 Cotswolds sheep, and their names are Hope and Pearl. With their goal to visit schools and educational settings, the Fluffy Friends currently they only host children on their farm. A young girl came to the farm who had tried all different types of therapies, and for the first 10 minutes, she didn't want to engage, said Emma. After that, she was in the stable with the sheep being cuddled. Over an hour, we started to talk, and there was laughter and smiles, and she's been coming back weekly since.
Oh, cute.
On some occasions, however, they have transported the flock to locals in need of emotional support. So we are a mobile service, which is unique, said Emma, explaining that they hope to secure more funding to expand their services. We can go to people's houses and help those struggling with loneliness and isolation. Every time we see a child benefit from their time with the animals, it gives us that passion to move forward and continue making a difference. So there's also a video that we'll post on the show notes for that. So I was like, wait a minute, sheep, therapy animals. Oh, this is my story for sure. And think about all the times that like in 4-H that we would do, petting zoo type things or taking animals, say, to a skilled nursing facility, including animals in the parade and, the non-traditional stuff, right?
We take it for granted because we've got animals around us 24/7.
Yes.
And there are a lot of people that don't. They don't have that exposure. And so they just think that is the best. Or like in the nursing home, they have had it, but now they're not living on the ranch or the farm anymore. I have a non-emotional support bottle baby calf right now. His name is Brutus. Twice a day, he just slobbers on me and slimes me out and headbutts me if his milk isn't ready. So it's
creating a little monster there,
he is the terror of the farm. Yes, but he's so adorable. He is so adorable that you can't be mad at him.
Oh.
Until he poops right where you're walking.
But you get over it quick.
After your poop scoop. Scoop poop?
Pooper scooper, yeah.
Yeah. Yeah. So I love that because you know, wherever people can get their good feelings.
I know personally that sometimes the most peaceful place for me after a long, crazy day is out in the pasture with the sheep, with our one token goat, Stetson.
He's a lucky
and then with
goat.
the dogs. Yeah. Yeah. Oh, Stetsy, he found himself on the wrong side of the pasture yesterday. So he was out in Never Land. I don't know how his little roly-poly must have somehow gone under the fence or something, and then he was just stranded out there. But goats being goats, they kind of do what they want and don't do what they don't want.
Oh, yeah.
So as we're trying to move him from the one pasture, you got to go through another one, out a gate, in a gate. And he just, for a second, he would just take off running like, yay, yay. Then he would just stop and just, brakes, put on the brakes, full stop. And then you're like negotiating with this goat. I can only imagine what the neighbors think. I'm literally down there talking to him like, Stetson, I'm just doing this for you. It's for you, buddy. Come on, you're going to feel better. You're going to have your food. You're going to have your friends. You're going to have your water.
No.
Then we get a little further.
Yeah.
Put the brakes on.
Yesterday I had to go to the store and get a baby-sized calf halter for Brutus.
Yes.
Because no more is he following me all the time. He's kind of decided he's the king. So I have to now lead him, and he has the brakes on.
Yeah.
Same thing.
Yeah.
Who's the boss? Not me.
Well, and how big is he?
Well, he was a twin that Mama wouldn't take.
Okay.
She kept the bigger, stronger one.
Yeah.
So he's only like maybe 40 pounds.
Oh, wow.
He's the cutest little tiny bitty thing.
Oh.
He's just so cute. But, he's
Still strong when they
Just-
put the brakes on.
Yeah. Yeah. Yeah.
Oh, I'm going to have to meet this guy.
Yeah. I should bring him to work so you
You
can.
should. Could you? Please? I'll clean up.
Oh, my gosh.
Okay. Well, anyway, we'll go. So listeners, if you have any verses or good news stories that you'd like to share with us, please email those to thecaregivenpodcast@gmail.com. And let's roll into our topic. We're going to be talking about hips and knees and replacements and surgeries and things to know. And
Yes. First thing we're going to talk about is some signs that you're ready for knee replacement.
okay.
So it's not always easy to know when knee replacement surgery is necessary. You and your doctor will take several factors into account to decide if or when joint replacement is right for you.
Mm-hmm.
If you're thinking about knee replacement surgery, you're in good company. Every year, more than 500,000 Americans opt for the procedure. Many people have knee replacements because they have osteoarthritis.
Mm-hmm.
This condition occurs when the cartilage, which is the tissue that cushions the knee joint, wears away. And you always hear about that bone-on-bone thing, right?
Mm-hmm.
As a result, bones do rub against bone, which is quite painful. Other people may need a new knee because they have rheumatoid arthritis, a disease that causes chronic joint inflammation. Oh, that sounds worse.
Mm-hmm.
Still, others may have had an injury causing knee pain and limiting function. I mean, we both know a guy. He's had 6 knees, but it's been because of trauma.
Yeah.
We won't mention that he was racing his motorcycle.
Oh, right. Yes. Be sure not to say that.
Yes. These conditions are known to cause gradual worsening of knee pain over a long period of time. It's not always easy to know when to have that knee replacement, just like with what my friend had hers done. She must have been in a lot of pain for a long time because she's a tough cookie.
Yep.
So basically, you got to have an x-ray, you got to have your MRI, your pain level. Did physical therapy work for you? What is your personal health history? And then your weight.
Mm-hmm. So basically, it talks about when, why you might come to the point in your life when you're like, okay, now's the time.
Right.
So what are some of the things that can be going on? Well, medications. So if you're taking a lot of medications and even that stronger anti-inflammatories, and they're no longer helping or easing your pain, that's something to consider. Other less invasive treatment options, they don't effectively reduce your pain and inflammation. Those would be things more like your cortisone injections, lubricating injections, even resting and doing some physical therapy. You have lots of difficulty and pain performing everyday tasks, just simple things such as dressing, bathing, getting out of bed, getting up once you sit down in that chair, or going upstairs, things that we take for granted every day, really. And then maybe you need the aid of a cane or of a walker. The severity of your pain, and if it is all the time, day and night, right? Pain's there even when you're not using your knees. You're just sitting around and experiencing the pain. there's also, you can get deformity in
Wow.
your knees. And sometimes that can be from trauma or, an injury or an arthritis. The one thing that they do say is that depending on the severity of the deformity, that can have an impact on the effectiveness of the surgery. So definitely things to talk about with your physician. And then also, just one of the factors, if we're being honest, is being between the ages of 50 and 80 years old. So most of the people that get their knees replaced are in that age range. But that's not to say that people of all ages don't get knee replacements.
Yeah.
Yeah.
Yeah. Well, you were saying taking it for granted.
Mm-hmm.
I tweaked my knee one time, and I'll never forget. That knee pain was hurt. And then like in the middle of the night, it would wake you up because it just hurt so bad. But I said, oh my gosh, there's really nothing worse than hip pain. Mm-hmm. But then I had a bad tooth one time, and I was like, oh my gosh, nothing worse than a toothache.
It's always whatever you're experiencing.
And so basically you take granted your body when it works, because then when it doesn't work, you're just like, dang.
You forget about all the good that your body has given you, and then when it starts to have an ache or a pain, you're real mad about it.
Yeah, really, really mad. Who's got time for that?
Yeah.
Some of us might say not yet, and that would be me forever.
Sure.
Because I'm not going and looking for any.
I know. It's scary. It's scary.
Yeah.
But
the whole thing is.
There's going to be some real not good outcomes, but I think the majority of the outcomes are really
what they can do nowadays with surgical procedures. So many of them not even a cut open wide thing anymore. It's more of a robotic deal.
Yeah.
But anyway, if you're thinking not yet, it's because you still have time to give conservative measures a chance. More rest, more ice, more strength exercises, and is the pain bearable with some medication, or can you still get around and do most of your normal activities without much difficulty? Bottom line is, how much are you going to tolerate until it just isn't going to work anymore? And then there's also an issue where your muscles have to be strong enough to be able to handle the new knee joint. So if you're weak sauce, it may be a thing where your muscles just aren't going to be able to help you. Or you have open sores or ulcers in the area that can become easily infected. Or you are overweight. And that's one of the things that I think about every time I have an ache or pain. I'm just like, well, if I wasn't packing this extra little cush, would that ache and pain be there?
Right.
So I always put a lot of emphasis on that. And then I think, I'm going to get on it, man. I'm going to start. But I think we've talked about the different pressure on knees and all of that with, every 10 pounds you're over, it adds a zillion more pounds of pressure, whatever the numbers are. But unfortunately, I know one gal that was going to have some kind of a surgery, and her doctor said, we can't do anything till you lose 50 pounds.
Right.
So she finally had to buckle down and do that.
Yep.
And to get the procedure done.
Yep.
So it's a thing.
Yeah. So definitely you want to be talking to your doctor, having conversations before you would make up your mind to have a knee replaced. You want to talk about possible risks of the surgery. Risks can include things such as infection, loosening of the knee replacement parts, movement limitations. You also want to talk about other health conditions that you might have that could make the operation and or the recovery more difficult. It's important, very, very important, to have realistic expectations for how quickly you are going to recover from the surgery. It can take several weeks to several months to feel back to normal after a knee replacement. You have to make a commitment that you're going to do physical therapy, that you're going to exercise, and it's not like you just go to the hospital, get your knee replaced, and then everything's great and you don't have work to still do, right?
We've had people that do that.
Yes.
They think they've had the surgery, so they're all better.
That's supposed to just fix it. It's like the pill, I take the pill and I'm supposed to be better.
Yeah.
And not really taking a lot of accountability for, no, you still have work to do.
And there's a lot of work after it. You have to, and it's amazing whenever you hear about a surgery where they're like, physical therapy is right there to say, okay, let's get up, let's get moving. I mean, they don't let you
they
sit
don't,
like
no,
they used to.
not at all. They get
like
them.
Move.
Yeah. And your doctors should be able to talk to you about things that you can do to either speed up your surgery and or things that you do or don't do that are going to slow you down. So I think it's important to pay attention to that stuff.
For sure.
Under the right circumstances, a knee replacement can significantly boost your quality of life. More than 90% of people who get new knees are able to resume their normal activities shortly afterward, and they're happy with the results. That would be according to the American Academy of Orthopaedic Surgeons.
Right.
Pinpointing a good time to have a knee replacement is a key part of having success with the procedure. So Ron, our friend that shows sheep with us, or his granddaughter does, he did have a knee replacement surgery, but he waited until after all of the showing was done for the year so that he knew he would be able to have that surgery, have time to recover, not be
until the next big session.
Until the next showing started over.
And did it do well for him?
Seems to be.
He's happy he got it done.
He seems to, I don't hear that it isn't going well, and I see him moving around really well, and so I think it was a good decision.
I did not know that.
Yeah. Well, let's talk about knee replacement from you had brought to us in our information from the Mayo Clinic.
Yeah.
So we think that that's pretty reputable.
Yeah. Yeah, so knee replacement surgery replaces parts of an injured or worn out knee joints. The surgery can help ease pain and make the knee work better. During the surgery, damaged bone and cartilage are replaced with parts made of metal and plastic. To decide whether a knee replacement is right for you, they check your knee's range of motion, stability, and strength. X-rays will show the extent of the damage. The right artificial joints and surgical techniques for you depend on your age, weight, activity level, knee size, and shape, and overall health.
Righto. Right. Well, why is it done? Well, most common reason for knee replacement surgery, it's to ease pain and primarily caused by arthritis. People who need knee replacement surgery usually have problems walking, climbing stairs, getting up out of chairs. And if only one part of the knee is damaged, surgeons can often just replace that part. If the entire joint needs to be replaced, the ends of the thigh bone and shin bone are reshaped, and then the entire joint is resurfaced. These bones are hard tubes that contain a softer center, and the ends of the artificial parts are inserted into the softer central part of the bones. It sounds pretty invasive.
Yeah, I'm like,
and scary.
Forget it. Yeah. I'll have knee pain my whole life.
Yes. Ligaments, those are the bands of tissue that help hold the joints together. If the knee's ligaments aren't strong enough to hold the joint together by themselves, the surgeon may choose implants that can be connected so they won't come apart.
Oh, wow.
So, I mean, it's just wild to you when you think about, let's just slice in there and we'll just take out the bad stuff and put in the new stuff. But I know my grandma Fisher had a knee replacement.
Oh, did she?
Maybe both, honestly, like a long time ago. And she's just tough, man. She just, you can't keep her down. So it was a good thing for her. Yeah.
And I've always heard that actually ligament damage is worse than if you literally like break a bone.
Yeah. It's like
ouch.
the sprain versus the bone break.
This.
Yeah.
Yuck.
It's like me and the mammogram. Okay, risks. What are the risks?
There are risks to anything that we do. Knee replacement surgery, like any surgery, carries risks. That includes blood clots, where they typically recommend blood thinning medications to prevent this risk. The most common location for blood clots is in the leg, but they can travel to the lungs and become deadly. Nerve damage, nerves in the area where the implant is placed can be injured. Nerve damage can cause numbness, weakness, and pain. Infection can occur at the incision site or in the deeper tissue. Surgery is sometimes needed to treat an infection. The implants used for knee replacement are durable, but they may loosen or become worn over time. If this happens, another surgery may be needed to replace the loose or worn parts.
Yeah.
So I'm thinking about our friend that has had 6 knee surgeries. I'm not even sure why. I guess I've never asked him, because does he just not let it heal good enough before he's out and about doing crazy stuff again, that he tweaks it again, or does he just wear out that fast? Or, everybody's body's different.
Yep.
But I next time I see him, he's going to be really thrilled. He's going to go, "Hey, you
talked about you on the podcast.
Talked about you on the podcast, and I had no idea what I was talking about. But tell me about it.
Yeah.
Why have you had to have
continual,
so many?
Is there damage just being done to what's there, and that has to be replaced, or is it? I mean, I've heard of like other surgeries where screws get put in and they will like back out.
Yeah.
And stuff like that. So,
but so he is a chronic situation.
Yeah.
That way.
Yeah.
Which that sure would slow you down.
Yeah. Yes.
Ouchie.
But not really, because he keeps going.
I know. I know. Yeah.
So basically how you prepare, it's like any surgery, you know, there's going to be things, food and medications. Your healthcare team might tell you or advise you to stop taking certain medications and dietary supplements before your surgery. Probably going to be told not to eat anything after midnight the day of the surgery, that type of stuff. But make sure you talk with your doctor, not just listen to the podcast. They're going to give you the specifics. And then preparing for the recovery for several weeks after the procedure, you might need to use crutches or a walker. So make sure that you arrange for that before your surgery. Make sure that you have a ride home from the hospital, help with your everyday tasks, such as cooking, bathing, doing laundry. I mean, how often do we get called where someone has had a surgery and they're just like, hey, I just need, you know, next 24 hours, need to get home, get settled, make sure this is taken care of. Yeah.
That's really smart.
Very much so.
Proper planning.
Very much so.
Yeah.
And then things that you can do to make your home safer and easier to navigate during your recovery. Consider doing the following: create a living space on one floor, so you're not having to go up and down stairs. Install safety bars or secure handrail in your shower or bath. Secure your stairway handrails. Get a stable chair with a firm seat cushion and back and a footstool to elevate your leg. Arrange for a toilet seat riser with arms on it if you have a lower toilet. Get a stable bench or chair for your shower. And get rid of loose rugs and any cords, trip hazards, those types of things.
Yeah.
For sure.
That's actually one of the basic things we do when we do a home visit is looking at those very things, because they're the biggest things. Now, the one thing I highly recommend, not that I have one at my house, but is those potty extenders. Because it's amazing at 4 to 6 inches of you having to go to the bathroom up and down. And
those toilet seat risers.
Yeah, the less you have to torque your knee.
Yep. Help yourself.
It's a thing.
Yep.
They're ugly, but if it saves
you know what? You reach a point in life that
comfort
is more important than beauty or pretty.
What to expect. When you check into surgery, you'll be asked to remove your clothes and put on a hospital gown. You'll be given either a spinal block, which numbs the lower half of your body.
Out for a second. So we have a mutual friend, Julie, and the hospital gown thing. So he had to stay in the hospital a couple days, just something weird came up. And anyway, he was so mad about being in that hospital gown and felt that it was so inappropriate that he couldn't have his regular clothes.
Oh, no.
So he just thought, and I could see my Grandpa Fisher being that way. I don't know if he ever was, but I could just see him being like, it's very indignant. I just don't want to be in this hospital gown laying around basically naked.
Yeah, flapping in the wind.
Flapping in the breeze, yeah. Anyway, sorry. So go back to the hospital gown.
So
you will have to put one on.
Did he get over it?
Well, I think so. I think eventually, because what are you going to do? You don't have a choice. And to be honest, I did ask if there was any concern about potentially leaving AMA. And so his daughter said no, because Mom did actually take his clothes.
Okay.
So they knew for sure he wasn't going to leave AMA with, just the hospital gown.
Oh, Lord. Oh, my goodness. So basically, if you have a general anesthetic, that puts you into a sleep-like state. Your surgeon may also inject a numbing medicine around nerves or in and around the joint to help block pain after your surgery. But then that does wear off.
Yeah.
Ouchie. Yeah.
Yeah. During your procedure, it usually is going to take about an hour to 2 hours, just depending. To perform the procedure, the surgeon's going to make an incision over your knee, remove the diseased and damaged bone and cartilage, leave the healthy stuff intact, and then implant the replacement parts into the thigh bone and shin bone and kneecap.
Them achy bones.
Yeah. Yep.
I don't know what the words are. So after the procedure, you'll recover in the area for a short time. How long you stay in the hospital after surgery depends on your individual needs. Many people will go home the same day. When I used to work in same-day surgery, basically everybody had to be able to drink and pee. After they did both of those two things, then they were able to go.
I remember when Kevin had a surgery, and I think it was his knee surgery, actually.
Yeah.
Because stupid motorcycle, right?
Yeah.
So he had one, and they do the surgery, and then they get him back into the recovery room, and they give you the drink, and you get some crackers, and he was really not having a good reaction to the coming out of the anesthesia. Just, nauseous and everything.
Yeah.
And they're like, just you can stay as long as you need to, just relax. It's no hurry. But at the same time that they're telling him that, they're like putting his shoes on and virtually being like, okay, get out now.
Oh my goodness.
Like the actions didn't match what they were saying. It's really quite funny.
Oh, Lord.
You can stay as long as you want, as long as you leave right now.
Oh, that's crazy. Move early. You'll be encouraged to sit up and walk with crutches or a walker soon after surgery. Apply pressure. Both during and after surgery, you'll wear elastic compression stockings or inflatable air sleeves on your lower legs. The air sleeves squeeze and release your legs. This keeps the blood from pooling in the leg veins, reducing the chance that clots will form. Take blood thinners. Your surgeon might prescribe or inject an oral blood thinner after surgery, depending on how soon you walk, how active you are, and your overall risk of blood clots. You may need blood thinners for several weeks. And you'll be asked to do frequent breathing exercises and gradually increase your activity level. A physical therapist can show you how to exercise your new knee. After you leave the hospital, you'll continue physical therapy at home or at a center.
Yeah. And basically results. So for most people, knee replacement provides pain relief, improved mobility, and overall better quality of life. And they do say that most knee replacements can be expected to last at least 15 to 20 years.
Oh, wow.
Yep.
Right on.
So, yeah. So after your recovery, then you get to start engaging in various low impact activities, walking, swimming, golfing, biking, but avoid the higher impact activities like jogging and
I do.
Yeah, same. All right, so we're through knees, and now we're to hips. 4 signs that you might need a hip replacement.
Oh, Lordy.
Tell me all about it, Jules.
Well, basically, there's no set rules when it comes to hip replacement. While the surgery is commonly associated with older patients, in truth, it's a life-changing procedure for anyone with a worn hip joint. We just had a friend have hers done. She was out for about 6 weeks. She's a new woman. But the funny thing is I hadn't realized she was in pain because she never really talked about it. And then all of a sudden she's like, hey, I got to take some time and I'll be out because I'm doing this hip thing. And I'm
like, oh.
See me, I'd be complaining and moaning and groaning the whole time. So that's why I guess I was so surprised she was quiet about
what?
it.
You need it, huh?
But then again, I guess I don't have any secrets. That's
true.
That could be it.
Yeah.
Okay. So anyway, the following signs may indicate hip arthritis or be symptoms of other problems. The best is the hip or groin pain. And that is one of the major indicators that there may be an underlying problem with your hip joint. And so when there's pain with walking, if it's preventing you from walking normal distances or completing your daily activities, then speak to the specialist. It's important to remember that this can be relative to you, like we're talking. For example, being able to comfortably stroll a short distance, but some people, to them, a normal stroll is 5 miles.
Right.
So it depends on your lifestyle.
Yes.
You may find yourself compensating with a limp, relying on a walking stick, or even needing painkillers just to cope with the pain of the walking or other activities such as climbing stairs or getting into the car. Pain during exercise.
It's all painful.
Yeah, that's relative because I don't do that on
purpose.
On purpose anyway, but jogging, swimming, for those of you that do that.
Right.
The pain is usually localized between your hip and knee. If the pain is lower down, depends towards the ankle, the problem may actually be caused by back problems. Yeah. So then there's stiffness in the hip or groin area, and then there's the one leg test. And if you can't stand on your problem leg for more than a minute, even with the support of a door frame or tabletop for balance, then you might have a problem with your hip.
I think I can stand on my leg for a minute, but I don't know if I can balance it. Like, I would need something. My balance isn't great. We'll practice that after this. Just for a little bit. We're really good at how we're doing.
I'm really good at it.
Standing on one leg?
Yes, because the other day Mike heard something, and I can't remember what it was, but he goes, I bet you can't do it. So, of course, I had to because he said I couldn't.
Yeah.
I stood on that one leg like a friggin' flamingo. It was so
epic.
Graceful. So graceful.
Nice.
Yes.
Okay, well, I will not be standing on my leg. Well, I'm going to practice now, though. Yeah.
Lying on your back or sitting, can you bring your knee to your chest? Assist with your hands if you need to. Lying on your back, you can move your leg out to the side without moving your trunk. Sitting on a chair, can you place your ankle on the opposite knee and let the knee drop down as far as possible?
I know for me, when I start to feel like I'm getting really tight in my hips, I will do that. I'll cross my leg over, and then actually on my knee, I'll just push like gently down and stretch. And it seems to give a lot of relief.
Yeah.
But yeah, I can tell how tight it is based on how far my knee goes down.
Yeah,
when
right. Yeah. I am, my personal test is my nemesis on the ranch, the fences that I have to crawl over. I will walk a mile around a fence before I'm going to have to go over it. But the other day I had no time to run the extra mile, walk the extra mile. Don't run. Anyway, so as I went to go over the fence, it was a little higher. So I really had to heft up this old cheek and get it over. And I popped.
Ooh.
And I was like, well, there you go. I'm dead. I'm stuck I'm stuck on this fence forever. And can you imagine going, Mike, would you get me off this thing? It would have been a really bad thing. So I sat there for a second and moved my toes, moved my nose. Everything was
Realized
fine.
You weren't indeed,
I was a
dead.
little dramatic, if you can even believe it.
Yeah, I don't believe it at all.
And so after I walk it off, you're fine. But I was like, did I just pop myself out?
Oh,
you know how you got the bone and the cup thing in. I hear this huge pop, and I'm just like, well, that would be dumb.
Yeah.
If the fence is what really did
you in?
What is that? What is that? Dumb ways to die.
Oh, yeah.
Yeah. I'm stuck on the fence because Mike would not help me down, and the crows
There
would
you
come
would
and
be.
I'd be stuck.
I would go looking for you.
Would you?
I don't know how long you'd last up there, but if I,
Well, if I couldn't move, it'd be a while.
Yeah. Anyway.
What a horrendous, terrible thing.
Okay, well,
That's why it's my nemesis.
have that.
Yeah. So, and then the other thing is if there's just no relief from other treatments.
Yeah.
And that's your medication, your all of the things. And so with that, let's just talk real quick. And the hip replacement is pretty much like your knee replacement.
Yeah.
Same therapies, same everything's.
Yep.
Just that other area. But it's amazing what they can do with hips. I mean, Grandma has fallen twice now and popped a hip each time. And just within a few days afterwards, she's up and moving and just in good shape. It's just amazing.
It is.
To me.
It is pretty quick. I mean, I know the recovery is a long time, like to build that strength back up.
Term,
But I think, I mean, pretty. I don't want to say immediate, but pretty soon thereafter. Yeah. There's a lot of relief.
And there are times when people say, "Oh, if she breaks a hip, that's going to be the downward spiral," right? And for some people, where else is their health besides that? So that impacts that and does cause that decline.
Right.
But for somebody that's at a pretty good normal status to have that happen, they're going to rally pretty good, especially with the way that they do things nowadays. Yeah. And they can do a partial hip or a full hip. I don't know how they do it.
It's wild to me. I don't know. I don't get any of it.
Yeah.
No. Like you said, we talked about so much of this when we were talking about knee replacements, and the risks are still very, very similar. With hips, though, it goes a little bit deeper. Blood clots. Yes. Infections. Yes. Fracture. So during surgery, healthy portions of the hip joint might actually fracture. Oh. Sometimes the fractures are small enough to heal on their own, but larger fractures might need to be stabilized with wire screws and possibly a metal plate or bone grafts. Dislocation. So certain positions can cause the ball of the new joint to come out of the socket, particularly in the first few months after surgery. If the hip dislocates, a brace can help keep the hip in the correct position. If it keeps dislocating, another surgery may be needed to stabilize it.
Owie.
Change in the length of the leg.
Oh boy.
So that would make a little bit of sense to me. So surgeons of course take steps to avoid that problem, but occasionally a new hip will make one leg longer or shorter than the other. Sometimes it's caused by a contracture of muscles around the hip. In these cases, progressively strengthening and stretching those muscles can help. Small differences in leg length usually aren't noticeable after a few months.
Okay.
Loosening. So although the complication is rare with newer implants, the new joint might not become solidly fixed to the bone or might loosen over time, unfortunately causing pain in the hip. And then again, a surgery might be needed to correct that problem. And then we had talked about nerve damage like in the knee. So
right.
You prepare for it very similarly, speaking with your physician and following all of the orders leading up to. And, you can expect pretty much a lot of the same things during the procedure. Basically, hip replacement takes closer to 2 hours. They're going to make an incision over the hip through the layers of the tissue. Yikes. Remove the diseased and damaged bone and cartilage. Leave the healthy stuff intact. Implant or replace the socket into the pelvic bone, and then insert metal stems into the top of the thigh bone, and then connect it back to that replacement ball. So just very weird.
Like you've said a million times during these podcasts, who thought of this?
I know. I know. It is great
wild.
that people have interest in this stuff and
Can fix us if need be.
yeah, and like every day it's something new,
Yeah.
right?
Oh, yeah.
And,
or new and improved.
Yep.
Yes. Yes.
All right. Well, what do you have for a grandma saying today,
Grandma
Julie?
saying, and we've all heard this one, don't let the cat out of the bag.
Ooh.
So there's an interesting story to this saying. Back in the day, piglets were sold in open markets. Then they were placed in burlap bags to keep them from getting away. Crooked merchants would put large cats in the bag instead of the piglet.
Ooh.
Because the cat was cheaper. I mean, I don't
I
get
guess.
it. Yeah.
Yeah.
If the buyer didn't check the bag before he left the merchant, he was stuck holding the bag, another old saying, and was without recourse. He could not prove he didn't swap them once he left the market. A shrewd buyer would open the bag to look before he paid the merchant and would let the cat out of the bag. Today, it means to keep a secret. So there's just been hoodlums all along the
I was just thinking to
ages.
myself, there's been crooks from the very beginning.
Can you imagine who thought about putting a
Ooh, we'll put a cat.
Couldn't you hear it meow instead of oink?
I would think, and like, how many times did one get burned with getting a cat in the bag instead of a pig before they decided to look in the bag? It's like, you know what? Real life, it's like going through the drive-thru. Do not ever pull away until you have checked the bag.
Oh, especially for the fry sauce. They forget the fry sauce.
Every time.
Every time.
Yeah.
Yeah.
Cool. All right, listeners. Thank you for being with us today.
Don't forget the fry sauce.
She was going to say, don't let the door hit you. I know her. Anyway, if you haven't subscribed yet, please do so. You can do that anywhere that you listen to podcasts, Apple Podcasts, Google Podcasts. Send us your good news stories. Send us your verses and your sayings. You can email those to thecaregivenpodcast@gmail.com.
Yes,
Peace out, Girl Scouts.
Do it, and have a great day.